We've talked a lot about the holidays during this show, but if you're not feeling well during the holidays, if you've got a back problem, a neck problem, whiplash, whatever the case may be, it's not as enjoyable. So let's get it together. Don't procrastinate. Chiropractor to you. I'm joined once again by Dr. Todd Black.
Hi, John.
And you allow me to call you Dr. Todd. That's okay, right?
You can call me. Just call me.
Okay. Just call me. There you go. And speaking of, do you need to call him? Well, let's find out what it's all about. So, chiropractor to you. When you articulate that to friends, the concept, what do you say?
Wow, that's a good one. It's actually a mobile service delivery for chiropractic that concentrates in personal injury cases. Those cases, oftentimes the treatment protocols are multiple visits per week, sometimes 3 times a week for 4 to 6 weeks. And so I kind of realized that that's a whole lot of time out of people's schedules these days. Most of us are already multitasking to begin with. So I was just like, what if I could go to some of my patients that are telling me I can't make this meeting because make my visit because I got a meeting. I was like, what if I could just drive up, be there when they come out of the meeting and work on them there, and then they could go back in their car and go to their next meeting. And so anyway, it's a mobile service delivery for chiropractic services, which concentrates in personal injury cases.
Okay, I think you answered this one, just to be clear, for those who are watching now. Okay, who calls you? Who do you hear from? What kind of clients do you hear from?
Well, really patients from all walks of life call me. I have a lot of, I think women, there's a demographic, right? So somewhere women are probably better at accessing care than men. That's just a traditional thing.
Yeah, men tend to procrastinate. Yeah. Women say, let me take care of it. Yes.
And guys, we need to fix that, right?
Yes, we do.
And I work a lot with patients that are from other countries. I have patients from Africa, patients from Latin American countries, and I really enjoy that. It's sort of a little different, and I get to use my acting skills to try to make up for my lack of ability to speak African and Spanish languages.
Sure,
so,
I understand. You're a people person, and when that translates, people understand when you really genuinely care about them, and you do that. We talked about procrastination. So for those who do procrastinate, talk about why not to do that. The scar tissue issue that you mentioned this last time you were on, I thought that's interesting. Tell me about that.
Well, first of all, anytime you're hurting, you should go get care. It's better to get checked out and find out that you're just fine than to think you're just fine and not get checked out. One of the things I treat is sprains and strains. People have probably heard of whiplash, and they kind of have an understanding of what that is, but why is that important to our bodies? And the truth of the matter is that when we injure ourselves, in a sprain or a strain, we either overstretch tissues or we actually tear them. Most of them are fibers, but they're all made of live cells. And so when they tear, they heal back with scar tissue, just like if you got a cut on your arm or something. And you'll notice that if you can see a scar on your arm, why is that? Well, the reason is because the tissue that came back to repair the damage is different. It is weaker and it is more pain sensitive. And so it's one thing to have weak tissue and be pain sensitive on your forearm, but what if that was in your neck? And every time you turn around, it hurts a little bit more, and you can move a little bit less than you did before the accident. So as a chiropractor, we like to go in there and work with those tissues while they're healing. Okay, it's going to heal one way or another, but it's going to heal better if you take care of it like most other things.
That makes sense. Okay, you said the magic word there, and one that makes some of us wince, and that's pain. Oh. So let's talk about this. Okay, the objective, of course, is to be pain-free. Does the actual process hurt, doctor?
Well, generally not. We have to take our patients in whatever condition we find them, and whether that be, like if they're really, really tender or sore, we're going to be extra careful and maybe take a little time before we even do that first adjustment, and focus on the pain management. For example, if someone is in a lot of pain, I could refer them to a pain management facility and then sort of co-treat with a medical practitioner.
Okay, let's talk about cost, because I think about chiropractor to you, as you can see, coming to your home, a concierge service, which is so in right now. It's the trend. So they come to your home, make it easy for you. So I'm thinking this is going to cost more, but you told me the last time you were on, you said no.
No. like I've said a few times, I think doctors make enough already. And so I use the exact same fee schedule for personal injury cases that I see in the field as I do if someone comes to my office at 2623 West Broadway. So it's the exact same fee schedule.
Yeah, and so different patients, different levels of care, and obviously concentrating on motor vehicle accidents. There's a reason for that, because the trauma of a motor vehicle accident, you know, going at a high speed, and sometimes, do you find this to be true, doctor, that people think, I'm okay, I'll get better, I don't need a chiropractor, because they don't, as you said, they don't see the injury. Do you find that those kind of people procrastinate because of that?
Well, yes, and I've even, you know, seen some serious cases where people thought they were just fine, or maybe they were mildly injured, and then over time, some tissue, some nervous tissue like spinal cord slowly degenerated, leaving them, you know, not in good shape. And so it was really good for that person, I think, that they were getting care and that they were documenting their case as they went along. Had they not done so, what would have happened if they just thought they were fine, went home, and then 6 weeks later, you know, they have major issues and then no way to explain it.
And it's important for you, and you do this in office. X-rays, it's important. You want to see the level of damage. You can see a lot with an X-ray, right?
Sure. You know, chiropractors, we like to look at the shape of the spine, and we also take our X-rays with people standing up so we can see how people are when they are weight-bearing. In the hospital,
aligned, right?
Most of the time people are laying down, which gets a really good view of some things, but really doesn't tell you about how that person is carrying their weight. So, and we have X-rays at my office at 2623 West Broadway, and I also will send people to outpatient X-ray facilities, which is kind of cool because they can just walk in with my prescription, hand it over, they usually get right in and get right out. And again, that's what it's all about, is trying to save people time when these unplanned events like motor vehicle accidents come up.
I love chiropractor to you. I love the concept. Congratulations, because I think a lot of people, you know, as you said, you know, one, time is money. A lot of times people are working, going to and from, or you've got to take the kiddos here, or you've got an event to go to, and you go, I don't have time to go to and from the doctor. You come to them. So what do they need to do? How do they set up an appointment? How does it work? You show up with the table? Is there a consultation process first? How does it work, Doc?
Usually, first of all, if you want to get in touch with me, you can go to my website. And if you go to my website, they will actually send you a postcard that has our phone number and contact information on it. So that way, if you're not in a car accident right now, but you want to make sure that you have access to chiropractor to you services in the future, they can send you something. It just goes right to your house. And what was the rest of that question?
Well, no, I was just saying, how's the process begin? And you did it. That's how does it start?
Well, that's one way. Yeah. And but a lot of times I'll just speak with people on the phone and find out what works best for them. First of all, find out what's bothering them and where they're located, and make sure that it's, you know, that's going to work out. And then I'll check with them to see, do they want home care, like for me to come to their house and work on them, or would they like me to bring my shuttle bus that's been remodeled to be in an office with electricity and all of that kind of thing.
I bet you they're happy to see you, because they've been saying, I need to see a chiropractor, because it works, folks. I'm telling you what, I've had chiropractic care, and it's fantastic. You're going to feel much better. And if you can't get around, then you've got the answer there. Chiropractor to you. He's Dr. Todd Black. Give me your slogan.
Remember, I'm Dr. Todd Black, and I've got your back.
I love it. Dr. Todd Black, he's got your back. Again, chiropractor to you.